Another story from the front page of the leadership newspaper. Patients stranded as nurses midwives strikes hit hospitals nationwide. Now, bear in mind that this organization is called the National Association of Nigerian Nurses and Midwives, NANNM, and they began a 7-day warning strike right after they've just concluded a 15-day ultimatum issued by NANNM to the federal government. They have disrupted healthcare services across Nigeria. So if you visit several federal medical centers, you will see that they are on strike.
Where do I start from?
Honestly, it's a valid.
Yeah, it is a valid question, and we continue to say in Nigeria that we're not even providing primary health care, which for a lot of primary health care you need nurses. You need more nurses than doctors, in my own opinion. Why? Because they manage the hospitals, they manage the inpatients, they manage the outpatients who come in to register, to check your what's it called? What do you call it? Your blood pressure, and a number of vitals. Yes. So if they are on strike and nobody is doing that, then what it then means is that hospitals are completely grounded. Who's going to give you an injection?
Yeah, people were returned home yesterday.
Yeah, that's what I'm saying. So who's going to give you an injection if the doctor sees you?
Imagine the number of people that would die in this.
Well, maybe they will die, but they could die. That's why I said maybe they won't die. You see, I didn't say they won't die. I said maybe.
Hopefully it's not
they
clear that they do.
However,
hope is not a strategy.
I agree. The truth of it is that we can go on and on and on and on, but the fact remains that nurses are on strike. There are demands that have been made, like many other associations in Nigeria have made those demands. And what is the government doing in terms of all that? We can even say we are not providing healthcare, we are not providing education, we are not providing security. What are we doing? You know, the report that came out a couple of days ago that everybody's been talking about, we're building government houses, we're building communication places. The Minister for Federal Capital Territory spent 39 billion renovating where you don't use every day. Meanwhile, hospitals are not being renovated, nurses are demanding for better conditions of service, doctors are demanding for better conditions of service, and all this, rather, some governors will build new government houses that they will stay for 6 months before they finish their term. And then the next one comes in and says, oh, we need to renovate and all. So we need to, first and foremost, let's focus on what are the main priorities for us? I like the word. You just keep it in there. Structured development. Then remember from yesterday,
highlighting priorities.
Priorities.
And that's what we want to look at in the course of this conversation.
Yes.
Priorities.
What are the priorities?
What are the priorities?
Priorities for me should be security in terms of providing the right architecture and equipment for security, education, healthcare. For me,
government is not providing security, healthcare, education. What is it doing? This is the question one of the presenters asked. What is this government doing? Remember, just a day or two ago, one of TINUBU'S spokesperson in Bola came on national TV and said that most Nigerians have given TINUBU the pass mark. So again, I ask, if a government cannot provide security, if a government cannot provide basic healthcare, primary healthcare, if the government cannot provide education for the people, in spite of the claim that they keep making 300,000 Nigerians have gotten loans to schools, what is the government doing? Nurses on strike. What has the government done? Lagos State government and doctors are on strike. What is the government doing? This is not a joke. We have entered what Nigerians call a one chance. We have entered a one chance government in this APC government, in this Bola TINUBU'S government. So if I ask you today, what is Bola TINUBU'S government's priorities? What are their priorities in the order of you want to list them? One of them you will say, as Wike said it, the International Conference Center, because he said the day he got into it was like, as a matter of priority, go and fix it, 39 billion. for a convention center that would still work and still generate money without you doing that amount of work. And you'd have infused that same money into schools. When Wike was doing the 39 billion naira worth of work for renovation, children were at home on strike. They didn't move a needle. Hospitals in Abuja don't have the even basic tools to actually check people. They don't have it. And then we have a government. See, this is the reason why when you come on TV and you support a government that is as catastrophic as this government, you have to be very, very concerned and aware that your family members will access those hospitals and they will be poorly treated. If you know what is happening with our healthcare system, you will weep because we don't have any. Our doctors have left, our nurses are leaving, our lab technicians are leaving. So who's going to do the tests? Who's going to give the people injections if they are all on strike? People on emergency, who's going to attend to them if there is an emergency on the road as our roads have become death traps? Who's going to attend to them? The casualties that an ineffective government leaves behind is something that you don't want to even sit back and then imagine. So I'm asking you again, when the government cannot provide security, electricity, healthcare, and cannot provide education for its people, what is the usefulness of that government? Because it has failed in its primary responsibilities. Our hospitals are completely grounded. When you don't have nurses, our hospitals are grounded. So what is the government doing? Again, I said Nigeria got into a one chance, ride with this current government, with this current political party. As a matter of fact, if you check it out for the last 10 years since the APC has been in power, they've literally grounded everything that we own as a nation, whilst they have gotten fattened by our commonwealth. Nigerians, wake up. All of you who are proponents of this government, wake up. We're going to suffer the consequences. The TINUBU will fly to France or England to go get healthcare. Where would you fly to? Look at your children, your family members in the villages. Our villages stinks of poverty. But then these guys can fly out of the country and go get treated, no matter what is happening in our country. So when you get on those vans and those buses supporting them, bear in mind, your father and your mothers will use the hospitals. Would they be able to access the kind of healthcare that Tinubu will get and his family members will get when they fly to France, when they fly to America, when they fly to the US or to the UK? Would they get the same amount of kind of care in Nigeria? By the way, what is your life like so far since this government has been in power? Because it's been one excuse after another. So again, I ask you, what is this government's priority? If it cannot provide healthcare, education, security for lives and property so that businesses can work and Nigerians can travel, what is the usefulness of the government to all of us? Put your comment in the comment section. Don't forget to like, to share, and to subscribe. I'll catch you up in the next video. God bless you. Bye bye for now.